I'm Dr. Hughes and the CEO of Viva Concepts. I'm here to describe to you the most simple expansion formula possible for any dental office across the country. What is that? I'm going to start off by telling you that Viva itself is a system. What type of a system? I'm going to tell you, it's a wellness program to retain your consumers. The single largest loss of revenue for any practice is the people who come in the front door and go right back out the back door. What does that do to a practice? Ask yourself this question. How long have you been in practice? How many years? And how many days of hygiene do you currently have? 2 days, 4 days, 6 days a week? That definition is 8 hours a day, 4 days a week is one full-time hygienist. So go back and ask yourself the question, how many days of hygiene have you had and for how many years? Here's the single largest unknown fact in dentistry. Over 90 to 93% of every consumer that walks in the front door goes out the back door. Do they leave the area? Do they go to a different dentist? Do they expire because of old age? Not most of them. They're still in the same area or region where your practice is located. Evidence is they'll show up about every 3 to 4 years and you'll have to go pull a chart out of the old files and lo and behold, Mrs. Jones is back in. What is the difference between a system being put in and trying to just market your practice? Viva is an educational program. It covers 4 basic business laws. Those business laws are the same for every single business in the world. They come from textbooks from Harvard Business School, Loyola, Pepperdine University, USC. They're the same laws for you as they are for Starbucks, Nordstrom's, a donut shop, a chiropractor, you name it. A cleaner's down the street. What are those 4 business laws? Let's take them up real briefly. It'll take about 3 to 4 minutes to give you a concept of what the Viva system is and what we work on. The first business law is called consumer acquisition. It's a law that's been around forever. You're going to always have to acquire consumers for the life of that practice. Any business has that problem, and there is a cost for that acquisition. What is the cost to acquire a consumer in dentistry? I'm going to cover a topic called metrics. Metrics are standards or the norm that occurs across the country. There is a cost of acquisition across the country that is pretty standard. It ranges on the low end of about $250 per patient up to $350 on up per patient that walks in the door. Well, that's pretty easy math to do. If you want to get 30 new patients into your practice in addition to what you already have, just do the math. 30 patients a month at $300 per patient is going to cost you about a $9,000 marketing budget. You won't like it. I don't like it. How do you reduce that marketing budget? You reduce that marketing budget by having an internal referral program that's on steroids, and that's part of the Viva system on customer acquisition. So back to what we started with, there's 4 basic laws. Law number 1 is customer acquisition. Any business has that law. The second law, when the consumer walks in to the organization or the business, you have a thing called consumer sales. That's business law number 2. For you, it's called case acceptance, treatment acceptance, whatever you want to call it, you have to sell the consumer. Well, what happens after you've sold them? You now have business law number 3. And business law number 3 is called consumer retention. And consumer retention is without a question the most important law of all 4 of them by a factor of 10. Consumer retention is actually the spine of the organization. Take a look at Netflix, AT&T, Verizon, T-Mobile, iTunes. Look at Mobile Oil, look at Amazon. They have retention of their consumers that come back over and over and over again. Your retention program is called a wellness program in the hygiene department. I'll come back to that in a moment. Business law number 4 is called a care factor, or let's call it a positive experience. I'm not talking about a Google review. I'm not talking about a Yelp review. I'm talking about a positive experience from a high care factor that is perceived by the patient. Those are all there is to any business. Those are the 4 laws. Acquire a customer, sell the customer, retain that customer, and number 4, treat that customer really with a high care factor called a positive experience, and you'll get referrals. What do those 4 business laws work synergistically together to achieve? Let's take a look at it. This next diagram I will show shows that the 4 business laws are feeding the size of your active database, or for you, the active patient base. As you grow the active patient base in your practice, the revenue will grow and the practice will grow. It's not the new patients, it's not the collections, it's not the production. It's the size of the active database. How come? Well, let's take a look at a simple business principle. Every single organization on the planet, every business, has what's called an ATV. Now, an ATV is an acronym for average transaction value. So every consumer that walks in your door, you acquire a consumer, they walk in the door. What is the average transaction value of that consumer? Well, across the US, there's a metric, and that metric tells you that every consumer, consumer A, that walks in dental office B, C, or D across the country is going to spend an average of $1,250 to $1,700 for the first year. So you get a call on the telephone, ring a ding ding, good morning, Dr. Hughes' office, how can I help you? What does the front office not know? Well, first off, the cost of acquisition is $300. Number 2, the average transaction value for that consumer when they come in will spend a minimum of $1,250 to $1,700. Let's round it off to $1,500. So for every call that she does not convert on your marketing, there's a loss of $1,500 to $1,800. Click off the phone. So the conversion rate is critical in marketing. So let's take a look at what the real problem is and what is the solution. Let's take a look at your database. How long have you been in practice? 5 years, 10 years, 12 years, 15 years, 18 years, 20 years or more. How many times have you mailed to your actual database? That's called a loyalty program. The loyalty program is critical to stay in communication with your consumer. Every single business in the world knows it if they have a CFO, which is a chief financial officer, and or a marketing director, because they know one thing for a fact, that their retention is the backbone of that business. So if you don't want to actually raise your revenue and grow your business, never mail to your database. I'm going to show you a couple of examples of a inspirational database mailer. This is an example of a patient mailer that goes to your database. Everyone is an inspiration to your patient. It is a gift. The back of the card has an offer for the patient to give to somebody in the household to refer a family member or friend. This shows how the actual patient mailer is mailed in a clear envelope so that it has a 100% open rate. And of course, the back has your office name and the name of the patient for mailing. When you open the card, what you'll see is an inspirational, iconic leader with an inspirational quote on every mailer, making the doctor long-term as a strategy an inspirational leader in his community. When you open it up, what you'll see is share it forward. And every time it says share it forward to family members and friends, to have them refer a family member or friend into the practice as a new referral. This is the Care to Share Viva Pack. It is an internal program on steroids. When it opens up, as you see, on the left-hand side is another inspirational gift, which is a quote from an iconic leader, and on the right side is an actual offer for a new patient. This is handed to existing patients to give to family members and friends when they go home so they can refer patients into the practice to assist them with their health care. Loyalty is missing in our industry. So Viva has 2 basic products, which is really an internal referral system with a high-end referral system that we train The retention coordinator, which that term's brand new, that's someone who is responsible for everyone who walks in the front door. Who in your office is responsible so they don't walk out the back door? Interesting. You'll find a finance coordinator, you'll find a receptionist, a scheduler, you'll find a office manager, you'll find a dental hygienist, you'll find a dentist, a dental assistant. Once in a while, you'll find a marketing director. But go find a retention coordinator, the most key position in any single business that exists. That's the person that we train. Every one of our programs has a training program that teaches the retention coordinator, how do you stop this 90 to 95% leakage? Good luck on figuring it out. It has taken us years to do. It takes us anywhere between 6 to 9 months to train somebody, and you'll see the retention and the number of hygiene days increases and the number of hygiene days increases, both production and days.
We conduct case studies, also known as outcome studies. Let's take a look first at some of the reviews and the results of some of the clients over the last year to year and a half. This first one gives an example going from $15,000 to $27,000 from August to December of 2018. This next one is from $17,000 to $31,000 in the same time period. This next one is a better increase from $26,000 to $47,000 from August till December. And this last one is from $29,000 to $49,000. Look at the increase on an annual basis of this last one. $240,000 a year times 10 years, it's $2.4 million in a 10-year time period. The most vital step is having a retention coordinator who is trained.
What is a hygienist as a retention department worth in an office? Well, you would have to know the metrics of the hygiene department. The metrics of the hygiene department are quite simple. The average hygienist upon graduation works 4 days a week. She works 50 weeks in a year. So there's 200 working days. She sees an average of 8 to 9 patients a day. So she can actually service about 1,800 patients per year. What is the average daily production across the country as a metric and benchmark in a fee-for-service / PPO practice? If you don't know that, the volume of revenue lost and retention is enormous. That's what we teach. It's beyond any scope that you would imagine until you see the math on it. And the entire Viva system is based on one fact. It's business principle and it's just math. Whether you like us or you don't like us is beside the point. At the end of the day, when you see the math tells the tale. We invite you to Viva. Come for a one-day visit to our office for an educational, find out what we do. We have one intention for every single client that comes on our program. And that intention for you and for your office is to expand it with a retention program, an internal referral program, and actually handling your database so they refer patients and have a care to share program in the households around your office.